Hello, my name is Peter Lawrence, and I'm happy to introduce the May issue of the Journal of Vascular Surgery, Venous and Lymphatic Disorders, and to highlight 4 outstanding papers which are freely available for the next 2 months. The first article highlighted in this issue is Surgical Resection and Graft Replacement for Primary Inferior Vena Cava Myosarcoma, a Multi-Center Experience, by Noramid and co-authors. They used the Vascular Low Frequency Disease Consortium to determine the best method for caval reconstruction after resection of a primary leiomyosarcoma of the IVC. 92 patients, that is 60 women and 32 men, with a mean age of 60 years were treated, with metastatic disease present in 22%. The tumor location was below the renal veins in 49 or 53%, between the renal and hepatic veins in 52 or 57%, and above the hepatic veins in 13 patients or 14%. The conduits used for reconstruction included ring polytetrafluoroethylene in 80, non-ring PTFE in 1, Dacron in 1, autogenous vein in 1, bovine pericardium in 4, and cryopreserved tissue in 5. Complete resection was accomplished in 79%, with an in-hospital mortality of 2%, and a median length of stay in the hospital of 8 days. The primary patency of PTFE reconstructed IVCs was 97% and 92% at 1 and 5 years, versus 73% at 1 and 5 years for the non-PTFE reconstructed IVCs. The 1, 3, and 5 year survival for the entire cohort were 94, 86, and 65%. The authors concluded that complete en-bloc resection of IVC leiomyosarcoma with vascular surgery reconstruction in selected patients results in low perioperative mortality and is associated with excellent long-term patency. A ring PTFE graft yields excellent long-term primary patency. Our next article, highlighted in this month's Editor's Choice, is entitled 10-Year Follow-Up of a Randomized Controlled Trial Comparing Saphenous Vein Ligation and Stripping of the Great Saphenous Vein with Endovenous Laser Ablation using Local Tumescence Anesthesia, by Egan and co-authors. They did a prospective randomized trial that compared the 10-year results of saphenofemoral ligation and stripping with a bare fiber endovenous laser ablation for the great saphenous vein when it was incompetent. 122 patients with 130 limbs treated included 68 limbs with a saphenous vein ligation and stripping, and 62 limbs treated with the laser. The 10-year freedom from groin recurrence was higher in those who underwent the stripping and were in that group, that is 73% versus 44% with laser. And the same trend was seen for clinically evidenced recurrence, that is 77 versus 58%. 9 interventions, or 17%, were performed in the stripping group versus 36% in the laser group. All interventions or re-interventions in the stripping group consisted of foam sclerotherapy, while re-interventions in the laser group included foam sclerotherapy, and it also required 11 additional endovenous procedures. There was no significant difference in quality of life and relief of venous symptoms, but there was a better cosmetic rating in those who had stripping compared with the laser group. This study showed no long-term advantage of the laser treatment of incompetent saphenous vein over high ligation and stripping of the great saphenous vein. The third article, by Dial and co-authors, Severity of Disease and Treatment Outcomes of Anterior Accessory Saphenous Veins compared with the Great Saphenous Vein. In this study, 103 limbs had isolated anterior accessory great saphenous vein reflux, and 10,370 limbs were compared with that and had isolated great saphenous vein reflux. Women were present in 95% of the interaccessory great saphenous vein patients, and it was much more common in this group. For the ablation-only patients, the anterior accessory and great saphenous vein had no intervention in pre-intervention, 1-month, and 6-month clinical severity scores. When phlebectomies were performed with ablations, the 6-month clinical severity scores were similar between the groups. The authors concluded that endovenous therapies for the treatment of symptomatic anterior accessory great saphenous veins have similar outcomes to patients with symptomatic great saphenous vein reflux treated with ablation. But patients with symptomatic anterior accessory great saphenous veins also require treatment of the associated tributaries to achieve similar results and outcomes to patients with great saphenous vein reflux. The final article in this issue's CME is Comparative Analysis of the Results of Cyanoacrylate Ablation and Radiofrequency Ablation in the Treatment of Venous Insufficiency by Daylon and colleagues. They compared cyanoacrylate ablation, or CAA, with radiofrequency ablation, or RFA, to treat great saphenous vein reflux. All treated veins in both groups were occluded at day 5. The 1-month closure rates were 97 and 98% for RFA, and the closure rate at 5 years was 93% and 91% for RFA and CAA respectively. Postoperative symptoms, SEEP classification, Doppler ultrasound findings, and 5-year symptom-free survival rates were 73 and 72% in the RFA and CAA groups respectively, and the venous clinical severity scores decreased similarly. The authors concluded that CAA, or the cyanoacrylate, has results comparable to those with radiofrequency ablation. Thank you for watching. For more information, please follow us on social media and remember to like, comment, and share. We hope you enjoyed these 4 highlighted papers and the other excellent papers in this month's Journal of Vascular Surgery, Venous and Lymphatic Disorders. Remember that these articles are free to read until the end of June. And thank you for your attention.